We're going to start off today with a very important thing, a special reminder about Breast Cancer Awareness Month and what it really means to be a survivor in the Quad Cities. We are so fortunate to have excellent care, treatment, and technology right here. My first guest represents a nationally recognized breast center, Dr. Melinda Haas, Medical Director of Trinity Breast Center at UnityPoint. And then there's Paula Thompson, a stage 3 breast cancer survivor, here today with her really cool hair.
Yep.
Paula, congratulations on your survivorship.
Thank
Stage
you.
3.
Yeah.
Dr. Haas here was your surgeon?
Yes.
Yes? Is that when you first met?
I picked her. Yes. Yes.
You chose her?
I did. Yes.
How do you like that, Dr. Haas?
It means a lot.
Do you hear that a lot? We have, I mentioned the excellent care here. It is nationally recognized. Tell us about that first, Dr. Haas.
Yeah, so our multidisciplinary breast center has been recognized for the last 15 years as a center of excellence.
You have a whole team, a big team.
Yes.
So when we talk about a breast cancer team, talk about a surgeon and the radiologists and oncologists.
Right, so there's the diagnostic team and then there's the treatment teams. And so we have the pathologists, the radiologists, and then we have medical oncologists, radiation oncologists, surgeons, all in the treatment team.
Well, you know, Paula, you as a stage 3 survivor now, you went through this a year or two ago. And you're still undergoing treatment?
A little bit. I did chemotherapy, radiation, more chemotherapy, surgery, and just doing some hormone blockers now for about 4 more years.
Well, you were younger when you were diagnosed. Any age under what, Dr. Haas, is considered a younger?
I would say in the 40 to 50, and then of course there are women that are even younger than when they're diagnosed.
I know, I feel like we're seeing that more. What was that like for you, Paula? Did you discover your own lump, or what was the procedure?
No, I had mammogram scheduled for March of 2020, and that was right when COVID was hitting, and I knew that they were going to kind of shut down elective surgeries. And I thought, well, I don't need this, it's elective. So I pushed it off about 6 months. So it was found in September of 2020.
Look at that. Now there's a word of caution, right, Doc? That she waited 6 months to get that screening.
And we did see that in COVID where there were delays in diagnosis, but for the most part we were pretty efficient at getting back to doing the routine screenings.
Let's talk about mammograms. The efficiency of detecting what we want to learn early. Are they really good?
Absolutely. They are the best screening test there is, especially the 3D mammograms. And for the average risk woman, that is what they need to do. And the American Society of Breast Surgeons recommends age 40 for the average risk lady. But the important thing is really to know, are you average risk or are you at elevated risk? And really that assessment should be done between the ages of 25 to 30 for all women.
How many 25-year-olds do you see who come in for that? Is that common at all?
I think it is getting more common because people are taking much more ownership of their own health care, and so we do want to be seeing these gals at 25 to 30 with their primary care doctors predominantly doing that initial screening.
Paula, you have a younger daughter.
Yeah, she just turned 25.
And
yes.
do you have you talked to her about this?
Yes, so hopefully she'll get with her primary care and just say what risk she's at and determine what to do.
I think we have some pictures of you in some of your wigs. This has been your claim to fame during your treatment here.
It was something fun to do, yes.
Did it help you? Oh my goodness, you do have a wig wardrobe.
Yeah, yes.
Look at you. Do you have a fave?
Actually, the one I'm wearing today, I like the color on this one. But,
yes, it's peacock colored. Look
so there's
how
a
pretty
lot.
she looks.
So, yeah.
Dr. Haas, when you see this, I mean, when you see women making the most of what they're having to go through, that has to lighten your heart.
It does, and I'm always amazed at how strong women are. We're survivors, and I'm always amazed at what the patients do and how graciously they walk through it. Because it's a long process.
I think, yes. My cancer was ovarian cancer, and I felt like my treatment was a lot shorter than what the breast cancer ladies have to go through, because there's radiation and chemo.
Yep.
And now you said the hormone treatments?
Yes, yep. So at least a year of active treatment, and then just little hormone blockers for about 4 more years, so 5 total.
Doc, we had mentioned the younger women being diagnosed. What do you have to say about that? Is it more aggressive at a younger age, or?
Many times it is more aggressive, but that doesn't make it less curable. If it's caught early, yes, they're going to get more treatment. It's going to take longer, but it still can be cured when you catch it early enough.
So frontline is the mammogram every year, right on time, and self-exams. Are a lot of problems caught that way?
Sure they are, yes, and we definitely support that, monthly self-breast exams.
Paula, I think you had mentioned to me that this is not something you would have been able to feel on your own.
I don't think so. I think it was pretty deep. Yes, yeah.
And lymph node involvement, we see that a lot.
Yep.
Sure, I mean, once there's lymph node involvement, it's going to be at least a stage 2 breast cancer, and we do see that. Many times it's stage 1 and there isn't lymph node involvement. Again, the screening mammograms, you catch it before you can feel it, and many times it's going to be an earlier stage, less treatment, more cure rates that are good.
Well, the other thing we want to mention is that you do not have to have a doctor's order in order to get a mammogram. You can just, well, make an appointment.
That's right. So to get a screening mammogram, you don't have to have a physician's order or a provider's order, but to use our online website, you do have to have a physician order for that at this point.
Okay,
Yep.
okay. Well, let's end with this. Paula, here you are during, Breast Cancer Survivors Awareness Month. What would you have to say to women who are watching right now and seeing what you've gone through? If we've heard some of your story.
Don't put yourself second. Get this screening done and get checked.
I mean, yours was just 6 months late.
Yep.
And it's hard to say. I mean, I'm sure you don't ever want to say to a patient, well, if you only would have been here earlier, maybe it wouldn't have been that stage. You can't know that.
No.
But I'm sure you tell yourself that all the time.
Yeah, but you never know.
No, yes, it's really true. And Doc, what would you like, some parting messages you want to make sure that everyone understands?
Really just that, and we've talked about this many times, Paula, it's just knowing your own body, your own health, taking ownership of it, getting your mammograms, doing your self-exams, and not being afraid to seek help. And really that we have here in the Quad Cities excellent breast care, and we definitely want to take care of our patients at UnityPoint. And
that's our bottom line. That the care is so good here. I mean, it really is. These care teams, Dr. Mindy's team, top notch.
Yep.
And Paul, I know you attest to that. So there's that website we were talking about, unitypoint.org/Quad Cities for all you need to know. Ladies, thank you so much for being here today. I'm hoping we encourage someone to go out and get their mammogram, get
Thanks,
that
Paula.
scheduled. Thank you both.
Thank you.